As many of you know that time is key in rheumatoid arthritis and other autoimmune diseases. If we don't treat on time, it can cause joint damage. And if the joint is already damaged, we cannot reverse those damaged joints. So you'll be losing an important function from your joints. As we are all aware, at RheumDoc, we try to educate people who have chronic autoimmune condition, including rheumatoid arthritis, on how they can feel better, how they can feel empowered. So as a part of that series, we have invited Dr. Quinn to talk about more of lifestyle medicine and how it applies to rheumatology. Welcome to our show, Dr. Quinn.
Thank you so much. It's my pleasure to be here. Thanks so much for the invitation.
Sure, and happy that you are here. Now, other important question I get from a lot of my patients is, how do we manage amount of sugar they are taking, how the sugar that take affect their immune health and autoimmune condition? Can you elaborate more on what is the role of the sugar that we eat on autoimmune diseases?
Sure. Sugar is often another processed food. The sugars that we get from fresh fruit are, again, surrounded with fiber and other things that help promote our health. But whenever we're in a dietary balance where we have excess calories over the calories that our body uses, the risk is that we will have undesired weight gain, and patients with rheumatic diseases have other challenges, sometimes with their mobility, sometimes with the need to take corticosteroids. What we know is if individuals have poorly controlled blood sugars and high insulin levels, that insulin is a growth factor, and it loves to take that extra fuel in the form of sugar that has been hard for the body to handle and to redistribute that to the mid-body. And so one of the things that we follow and talk about is mid-body weight gain. And there's a growing awareness in medical communities that it's much better to focus on where you carry your excess body weight than how much excess body weight you carry. So BMI may not be the ideal predictor for outcomes. And the reason for that is if you store fat or adipose tissue within the abdominal cavity, in that environment, it behaves in a very inflammatory way. You know, people have the misconception that adipose tissue is a benign storage compartment in our body, but it's a very metabolically active tissue. Once within the abdomen, it likes to surround the liver, can cause liver irritation in the form of fatty liver disease. And so we are always trying to help folks be careful about high sugars that stress their system, result in insulin resistance, higher insulin levels, and the development of mid-body weight gain. Let me just also add, as you know, that women are some of the primary sufferers with rheumatic diseases in midlife. And one of the things that happens in the perimenopause is that with the loss of estrogen, there's a new imbalance between estrogen and insulin, so that insulin is even more powerful to weight around the mid-body. So following a measure like waist hip circumference can be a very effective way to assess risk and measure success when folks are changing their eating habits to healthier approaches.
So basically summarizing what you just told, so increase sugar, increase your insulin level, that increase your risk of insulin resistance, that lead to the fat redistribution, particularly in your trunk area, which is the most significant risk of having problem like rheumatoid arthritis or other autoimmune disease and heart disease. So not all fat is the same, and not fat anywhere in your body is not the same. So having the fat in the central part of your body is a primary problem. And other very important thing we heard is fat cells are not just the fat cells. They produce hormones, they produce cytokines, which are like the chemicals that cause inflammation, such as TNF, IL-6. All of those chemicals are also produced in your fat cells. So if you have excess fat cells, then you will be at higher risk of having autoimmune disease. Now, that also brings up a common question I hear these days is the role of this newer medication, the GLP-1 blockers. What's your thought and what's your experience using those medication in patients who have autoimmune disease and who are overweight?
So our approach to GLP-1 agonists is to work with patients ideally before they make that step to put in place these lifestyle tools to help manage, because even if one chooses at some point to use a GLP-1 agonist, they still need to be working on these lifestyle changes. They still need to have a healthy diet. They still need to get their sleep. They still need to move their body. So those medications don't offer as much health benefit unless you can connect them. Furthermore, if an individual is ever going to be in a situation where they would discontinue the medication, if they haven't done the work of changing these other approaches to lifestyle, then they are much more likely to suffer significant undesired weight gain when the medications are terminated. Having said that, these medications are very, very important tools. And as we're learning, they are very helpful in managing other chronic conditions, be that the fatty liver disease we just alluded to, or obstructive sleep apnea. They have impacts on cardiovascular disease. And so we want to continue to accept that they are very helpful in the management of folks who have these unfortunate developments in their health, but they are expensive, and unfortunately in the world that we live in right now, they are not uniformly available to everyone. And so we want to be sure that if they use them and have to stop them, they can have still long-term success.
Yeah, going back to the same basic foundation, right? The nest, the nutrition, exercise, sleep, and stress management is the baseline. That's your base upon which you can add supplement, you can add GLP-1 inhibitors, or other changes you can do to manage your health, to manage your overweight. So I think that might be the main focus of the current discussion. Is that correct?
Yes, and the same is true with rheumatologic conditions, is that we love to have this foundation of stability, but patients still need to work closely with a rheumatologist and use the tools that we now have available to really turn off and put their conditions in remission and to live the good life that they're entitled to.
Now, segueing to that question, so some of my patients who come to see me, they ask this question: can I manage my autoimmune disease without taking any medication and just with the lifestyle changes? What will be your answer to those patients?
Well, of course, it depends upon the severity of their illness. Certainly, when we're treating individuals who have osteoarthritis, we know that nutrition and weight management and exercise are game changers. And I had the pleasure of participating in a clinical trial called We Can with folks at Wake Forest and UNC, and we were able to show with knee osteoarthritis that nutrition and exercise could make a difference in patient outcomes. But for aggressive systemic inflammatory conditions, we would not want patients to be misled into believing that those conditions can be managed just with lifestyle issues. Lifestyle issues, as I said in the beginning, are so important to their self-engagement, to their empowerment to be co-managers of their illness. And we all feel better if we get enough sleep and if we're eating well and moving our body, which it makes it easier to cope with the other things that are going on in our system.
Absolutely. Thank you. Yeah. But I usually tell the same thing, like we can empower patients to make those lifestyle changes. So it's more of an empowering to them that they have an important role in managing autoimmune diseases. So all of you who are having rheumatoid arthritis, if you're listening to us, you feel empowered if you can work on your lifestyle, working on your nutrition, exercise, sleep, and stress management. That empowers you to make a positive change in your health. But just doing those 4 things may not fix your inflammation. That's why we need to add the supplement. We need to add the medication that can help you feel better faster. As many of you know that time is key in rheumatoid arthritis and other autoimmune disease. If we don't treat on time, it can cause joint damage. And if the joint is already damaged, we cannot reverse those damaged joints. So you'll be losing an important function from your joint. So it's always important to look at those lifestyle changes, implement those, but also add safe and effective medical treatment in coordination with your rheumatologist. And even you can find nutritionists and other lifestyle coaches who can help you incorporate those 2 things, the lifestyle medicine changes as well as the medical treatment. And this holistic way is the best way of managing your RA long-term or any other autoimmune diseases. So we are almost coming closer to our session today. So before we leave, let's quickly highlight on what we talked today, and then Dr. Kun will explain us how or what are the simple actionable items each of you who have rheumatoid arthritis can do on a daily basis, typically focusing on the diet, what you can do on day-to-day basis to make make you feel better with lifestyle and dietary changes?
Sure. So we talked about how important it is to the management not only of rheumatic diseases, but the evolution of other chronic systemic diseases to eat real food, whole food, rather than processed foods. By doing that, we allow our body to get very important components, including fiber, omega-3 fatty acids, and avoid excessive sugars, refined carbohydrates, and other things that will have the tendency to increase our blood sugar levels and place us at risk for high insulin levels, insulin resistance, and undesired weight gain, often in areas where even more inflammation arises. One of the tools that we teach our patients is we work with them to figure out new ways to try seasonings and supplement their food with things like cinnamon and turmeric and garlic and other things that can make the food pleasant and enjoyable, but also deliver some anti-inflammatory benefit. So we want to give our whole body the benefit that comes from eating real food and whole food. And that is the underlying premise in all of the anti-inflammatory approaches to nutrition and diet. And with those things, I think folks can learn to improve their own capacity to be team players and feel good about where they're going with their illness and its management.
Now, before we depart, Dr. Quinn, can you tell a little more about our audience and what you do, how they can find you, and how they can use your services?
So I practice lifestyle medicine with a team of registered dietitians, and we are a virtual practice, so you can find us online. We serve residents in the state of North Carolina, so if you live in the state of North Carolina, we would be delighted to meet you and work with you. You do not need a physician referral to see us. Our practice is called Whole Health Partners, WHOLE, Whole Health Partners. You can find us online. You can make an appointment online. We love to be members of your team, so we will always ask you to communicate with the other people that are taking care of you, but we would be anxious to help anyone who is struggling with rheumatic disease or any other chronic condition, or who is worried about the potential to develop a chronic condition because of a family history or exposures that they've had.
Excellent. Thank you so much for your time today, and I hope all of you enjoyed and learned quite a bit of things related with lifestyle medicine, focusing more on diet. And if you like the video, please like and subscribe for more similar content on how we can fight against this indivisible battle of rheumatoid arthritis and other autoimmune condition using lifestyle changes as well as medical treatment. And then stay healthy. Take care. Bye-bye.